Today we are going to talk about lupus and the effects of exercise.
I don't know what lupus is. What is it exactly?
Lupus is a chronic inflammatory disease that occurs when your body's immune system attacks your own tissues and organs. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs.
It's never lupus.
Signs and symptoms of lupus include fatigue, fever, joint pain, stiffness, swelling, butterfly-shaped rash on the face that covers the cheek and bridge of the nose, skin lesions that worsen with sun exposure, fingers and toes turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, and possibly memory loss.
Lupus.
The goals of treatment include reducing pain, reducing inflammation, improving function, and decreasing joint damage.
These are the topics we will be discussing in our video: adaptations to exercise and equipment, common challenges, and suggestions for appropriate communication.
Lupus.
Adaptations for clients with lupus.
People with lupus get most and largest lasting benefits from low-impact activities such as training with resistance bands, Tai Chi or yoga, flexibility, swimming, and walking.
With lupus?
Clients with lupus resistance training program would consist of 2 to 3 days per week of resistance training. Lupus patients don't see benefits from high reps, high resistance, or high impact. Resistance training programs consist of full body exercises, one set of 2 to 3 reps, progressing up until 10 reps.
Da poca picchita va bene, se tu la parla miezza americano, quando si fa l'amore sotto la luna, come da viene in capo di I love you, papà l'americano.
Cardiovascular training consists of 3 to 5 sessions per week. Lupus clients are unique because duration is more valuable than intensity. 5 to 10 minutes is sufficient initially, but clients should progress toward 30 minutes of cardio. Modes of cardio training can include walking, cycling, swimming, hiking, or gardening.
I was tired of my lady, we'd been together too long.
Lupus.
Flexibility training consists of 1 to 2 sessions per day. Gentle stretching or passive range of motion for 10 seconds of all major muscle groups helps the lupus patients from stiffening up and allows them to loosen up.
Hookah chaka, hookah, hookah, hookah chaka, hookah, hookah, hookah chaka, hookah, hookah, hookah chaka, hookah, hookah.
I can't stop this feeling deep inside of me. Girl, you just don't realize what you do to me. When you hold me in your arms so tight, you let me know everything's alright. I'm hooked on a feeling as candy. Its taste is on my mind. Girl, you got me thirsty for another cup of wine. Got a bug from you, girl, but I don't.
Common challenges for patients with lupus include joint pain, inflammation, decreased range of motion, decreased function, and increased fatigue, especially during flare-ups. It can be very difficult for lupus patients to complete everyday tasks during flare-ups.
In an autoimmune disease such as lupus, your white blood cells mistakenly make antibodies to mark some of your own body's cells and circulating chemicals for destruction. When the antibodies attach to your normal cells, your white blood cells begin to attack them as if they were foreign antigens. Over time, this autoimmune response causes inflammation in the parts of your body wherever this attack is happening. Inflammation makes the blood vessels in the affected area expand and leak fluid, causing redness and swelling. The symptoms of lupus happen as your immune system begins to attack different areas of your body. You may develop a butterfly-shaped skin rash on your cheeks and nose. Small sores or ulcers may form inside your nose or mouth. You may develop arthritis, in which your joints become inflamed and swollen. When your fingers are cold, they may turn a blue or white color. This is called Raynaud's phenomenon. You may have pain during deep breathing caused by pleurisy, a condition in which the outer lining of your lungs is inflamed. Your white blood cells may create antibodies that attach to bits of your DNA from worn-out cells. The attached pair, called an immune complex, can lodge in your kidneys and cause inflammation. This disorder is called lupus nephritis. Flare-ups of any of your symptoms, even those not related to your skin, may be caused by an unusual reaction to sunlight called photosensitivity. Other common symptoms of lupus include extreme fatigue, headaches, fever, a reduced number of red blood cells in your blood called anemia, swelling of your legs, feet, hands, or skin around your eyes, muscle pain and weakness, and hair loss. Lupus is sometimes called the great imitator because its many symptoms are found in other health problems.
Communication is paramount for CUPs in lupus patients, as lupus patients may experience extreme pain and reduced range of motion. Exercise may not be beneficial during flare-ups.
The rash. It's lupus-induced kidney failure for lupus nephritis.
It's lupus.
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 It's not lupus.
Lupus is a bad diagnosis.
It's not lupus.